Dr. Evans, a few points before rounds. Mr. Peterson in bed 3. His bloods show a persistent anemia. We need to investigate the underlying cause, perhaps a GI bleed. Then there's Mrs. Gupta, post-op day 1, reporting significant nausea despite antiemetics. Try a different class of medication. And young Masterly, the appendicectomy yesterday, has a slight temperature spike. Keep a close eye on his vitals for any signs of infection. However, my primary concern is Mr. Davies in cubicle 5. His potassium levels are trending dangerously low, and I suspect it's exacerbated by his current diuretic regimen. We need to adjust his furosemide immediately, as this could precipitate an arrhythmia.
Right, Dr. Mihira. So, for Mr. Davies, it's the furosemide causing the hypokalemia, not just dietary intake?
Precisely, Dr. Evans. While diet plays a role, the profound drop suggests the medication is the primary driver in this acute presentation.
Mihira, I know sudden health concerns can feel overwhelming, but you are in safe hands, and we will take good care of you. Everything points to a kidney stone, which forms when tiny mineral deposits accumulate inside the body. Right now, it seems the stone may have moved out of the kidney and into the ureter, the narrow tube connecting the kidney to the bladder. Because that tube is quite small, a moving stone requires proper hospital care to manage safely and help it pass without complications. Once you arrive, the medical team will run a few routine diagnostic tests, such as an X-ray or a scan, to pinpoint the exact size and position of the stone. From there, they will choose the gentlest way to treat it. Most often, doctors use modern laser treatment to break the stone into tiny pieces so it can pass naturally. Please rest assured that major open surgery is extremely unlikely, as non-invasive methods are almost always effective. You are going to get through this smoothly.